Hi, I'm Smrithika and I will be presenting the importance of patient and public involvement and public engagement in research. Patient and public involvement, often abbreviated to PPI, entails research being carried out with or by the members of the public rather than to, about, or for them. This may include working with research funders to prioritize research, offering advice, commenting on and developing research materials, and undertaking interviews with research participants. The contribution of patients and the public is valuable because it provides an alternate viewpoint from the research team or NHS staff. The patients are able to make judgments based on their condition and may have different wishes about health outcomes that the researchers and healthcare workers may not have thought of. There are many benefits from public involvement. The research is more likely to be conducted and designed in a way that most suits the patients and the public. This leads to the development of higher quality research and easier recruitment of participants. Involving the public in especially sensitive or controversial research can help produce research that respects the safety, dignity, rights, and well-being of participants and future patients. Checking that arrangement for participants are appropriate and a respectful use of their time can improve the experience of participating in research. Making it easier for future patients to understand the process and potential risks and benefits of the research, and providing information on the process of research as well as the final results, both improve the informed consent process and the communication between researchers and the patients. This can reflect positively on the ethical review process. Public engagement in research is a range of ways of engaging members of the public with the design, conduct, and publication of research. This is all with the goal of generating mutual benefit by enhancing the quality and socio-economic impact of research. The aims of public engagement can be broken down into three main categories: informing, consulting, and collaborating. Public engagement should inform and inspire the public about research and increase its accessibility. For example, the researchers could create engaging presentations and writing aimed at non-specialist audiences. Consulting the public better informs the researchers on the views and concerns about research, and is also an opportunity to hear fresh perspectives and insights. This could be done using online consultations, panels, or patient participation groups, as shown in the picture. Collaborating encourages public participation in research by involving the public as researchers or developing collaborative research projects. This helps define future research direction, policy implementation, or application of research outcomes. Public engagement is important because it empowers the public. With the communication lines open, they effectively communicate with the researchers and healthcare workers. People have the power to directly influence the way research is done in order to suit them best. This improves the researcher's knowledge of those patients' experiences and concerns, which can be used to create future people-centered health research. Public engagement also helps people respect and value research by bridging gaps between the researchers and the consumers with understanding and trust. A recent study for the California Healthcare Foundation showed that increased patient engagement online resulted in a 90% satisfaction rating. This shows that public engagement actually has a significant benefit on how research runs. These factors are especially important because they follow the fourth principal value that guides the NHS. The patient will be at the heart of everything the NHS does. This essentially means that patients should be involved in all decisions regarding their healthcare and treatment. Despite not being in a hospital setting, research still has an effect on the care and treatment the public receives, and so they should be involved in the decisions behind them. In conclusion, patient and public involvement and public engagement is vital to research because overall it improves patient satisfaction and the satisfaction of the researchers. It builds trust between the healthcare staff and the public, making it easier and more effective to communicate and produce outcomes that are tailored to the population's needs. Thank you for listening to my presentation.